The guests and discussions on this show are not endorsed by the show or show host. The content is provided for informational and educational purposes only. Nothing you hear is intended to substitute for medical advice, diagnosis, and/or treatment by a qualified health professional.
Welcome to Health Revolution with V, your integrative health adventure. Welcome to the Health Revolution with V show. We have a very special guest for you today. Her name is Kerry Jenkins. She is a certified physician's assistant that had been practicing dermatology for 23 years. She decided to found Whisper Health Functional Medicine and in 2018 and has been serving South Florida for the last 5 years at the time of this recording. She enjoys clearing chronic skin conditions without using potentially harmful medications, focusing on the whole person, mind, body, and soul. And that's what the Health Revolution with V is all about, bringing you all of these amazing people. And you can see the other Health Revolution with V shows at eatingwithv.com. That's eatingwithv.com and click on Health Revolution. So without further ado, I want to bring on Kerry Jenkins. Kerry, welcome to the show.
Hi, V. Thanks so much for having me.
Oh my gosh, it is such a pleasure. When we were going back and forth, I thought how exciting to have a functional medicine practitioner coming on to talk about that. So we want to dive right in. I don't have a ton of time with you, so I'm going to really pick your brain while we're here. So first off, can you tell us about you? Who is Kerry Jenkins? What put you on this path that you're on right now in functional medicine?
Yeah, so I went straight out of PA school into dermatology. I was very fortunate to secure a job in dermatology, and it was amazing. I absolutely work with a great group of physicians, and I really enjoy my job. And I practiced like you mentioned for 23 years, and about 15 years in, my youngest daughter started experiencing some tummy troubles, just some very vague digestive upset. And that was the linchpin that launched me into functional medicine, because I knew that if I took my daughter to the pediatrician, she would be worked up appropriately. Ultimately, she would be, imaged in some form. She would be scoped from the top, scoped from the bottom, prescribed a medication, and maybe even labeled with IBS. And I knew deep down in my soul that that wasn't the answer. So I started searching for different alternative methods to hopefully get her back on track. And that's how I found functional medicine.
I absolutely love that. We all have I think any healer, any practitioner is brought to this work, whatever that looks like for them, because of healing naturally or helping someone heal naturally. And that what you said just triggers a lot of people, I'm sure, who are listening, because how many times do we go and get worked up, and they come back with no answers, And I think
you go to the doctor and you go through the process and they say, your labs look great. There's nothing wrong. And you're like, there's something wrong because I don't feel well.
Right. So this is a perfect segue. Let's talk about now, what is functional medicine?
So the official definition of functional medicine is, the functional medicine model is an individualized, patient-centered, science-based approach that really empowers patients and practitioners to address the underlying cause. Really, we want to identify the underlying cause of disease, and we want to promote optimal wellness.
Yeah, and it's so important. I think, unfortunately, our doctors are not getting the nutritional training, and it really does come down to nutrition a lot of the time, that the body's just fighting back whatever it is that we're eating or drinking or doing.
Yeah, it does. Food is medicine, and that's what we preach.
What are you seeing a lot of in your practice? Like in general, what's a lot of what's the common theme coming in?
Autoimmunity. There is so much autoimmune that is completely undiagnosed in the medical system. The allopathic medical model, you have to be pretty far down the road to be able to be diagnosed with an autoimmune condition. So the way in which we're working and doing advanced diagnostic testing, we're identifying autoimmune process at the very, very onset, so it's like stage 1 where it's really silent and it hasn't manifested symptoms as of yet, but really there's so much autoimmunity out there, and it's really, it's just not being picked up quickly.
I agree with you 100% on that one. I mean, that is, well, you and I would probably agree 100% on a lot of things. But yeah, I feel that is the case too. There's so many people silently suffering and they don't realize it says, oh, I see. Look at that. Is that a cat?
Yeah, that's Lucille Ball. She, whenever there's a Zoom conference going on, she photobombs. So my apologies.
I love that. Hello, Lucille Ball. I'm a cat lady. Most anybody that knows me knows I'm a cat lady. I love it. So welcome, Lucille Ball. We love having you back there. So your practice being different than a regular practice, can you share like some of the testing or like different things that would make you different? What are some things? What can someone expect when they come to your office?
So there's a few things that set us apart. Primarily, it's the time that we spend with people. My intake process, the very first visit that I have with a patient is 90 minutes long, and we review their entire health history from the day they were born up until wherever they are in their life right at that time. So it's really the amount of time and the amount of listening that we do as functional medicine practitioners. I'm trained to ask very specific questions and then be quiet and allow the patient to really tell their story. People really do know what's wrong with them if they're allowed, if they're supported in the right way to tell their story. People will tell you what's wrong with them. We just have to be quiet, listen, and really hear them.
I agree with that 100%. I think that we at this juncture need to take a quick commercial break, but we are definitely going to come back and dive into those other things that are making your practice so different from the regular medical world. And I'm excited to hear that. So don't go away. We will be right back. We have to honor our commercial sponsors who make this show possible. And we'll be back in just a moment. Have you been told that you need to cut way back on sugars due to a health condition? Do you find yourself struggling to give up the sugars even though you know your health depends upon it? If you answered yes, my online Hidden Sugars class is for you. Take charge of your health and visit eatingwithv.com and take the class.
At Two Men and a Truck, we'll treat you and your belongings like we'd treat our own grandmas.
Here we go!
Hi there. Hello there. Welcome.
Whether we're moving you across town or even across the country.
Visit twomenandatruck.treasurecoast.com.
Forever Young Stuart can help you look and feel your best with our amazing aesthetic services, IV therapies, and bioidentical hormone replacement therapy. These services and more will aid in your overall physical and mental health. Please visit us at foreveryoungstuart.com. That's the number 4, everyoungstuart.com.
Aapex Electric is a family-owned and operated, licensed and insured electrical contractor with over 30 years of experience. No job is too big or too small. With free estimates and a 1-year warranty, Aapex Electric is your premier contractor on the Treasure Coast. AAPEXelectricinc.com.
Welcome back to the Health Revolution with V Show. We have a very exciting guest on. If you've missed any part of this, please go back and watch. We have Kerry Jenkins on. She is a certified physician's assistant, also the founder of Whisper Health Functional Medicine, which you can find at whisper-health.com. That's whisper with the dash health.com. So welcome back, Kerry. We were talking about how Kerry spends a lot of time, like your first visit with her patients is 90 minutes. You'll never see that with a regular doctor. There's just impossible. But Kerry, I know there's a lot more that's different. So can you share some of the other things that are different about your practice?
Yeah, absolutely. So we really dive deeply into labs. We do basic lab work through conventional labs like LabCorp and Quest, but we do really thorough lab panels. So like typically if you were to go to your primary care physician or your internal medicine doctor and say, I'm struggling with fatigue and constipation and I'm feeling cold, if that doctor suspects that you may be suffering with a thyroid problem, they're going to run the very basic thyroid tests. where we as functional medicine practitioners are trained to look really deeply. We're ordering 8 different labs just to check the thyroid and evaluate the health of that thyroid gland. So we do really, really thorough lab testing with regular blood work. And then we also have access to advanced diagnostic testing like stool analysis. We do cortisol panels to address the adrenal glands. So those are 2 tests that we do really, really frequently just to help evaluate where a patient is and, what may be going on.
I think that is so awesome because having all of that extra data is so important. It tells you the different functions of the body and things that are going on that they're not going to see in just some basic testing. Do you all do do you do the microbiome testing as well at your place or?
Yes, we do. A stool analysis, we address the gut microbiome because, as you know, being a food and nutrition advocate, if your gut microbiome is not happy or healthy, you're not going to be happy or healthy. So we do that comprehensive diagnostic stool analysis to address the gut microbiome. It shows us how digestion is functioning in that person. It lets us know the level of inflammation in the gut. That test is really, really helpful for us when we're working with a patient that does have some gastrointestinal symptoms.
I think that's amazing because, people through decades, they suffer silently again with stomach issues and don't realize that it could be something as simple as, helping to change the gut microbiome, changing something you're eating. So that's exciting, very exciting. So what can a client expect? Like if they're coming to you, they call up your office. Can you walk us through what that looks like?
Yeah, absolutely. So my assistant, her name is Brittany. She's the one that helps all of my people get their scheduling appointment. Our first appointment is a getting to know you call, where we spend about 20 minutes just seeing if functional medicine really is the right fit for that person and what type of struggles they may be having. So I often ask them, what they have done in the past as far as what type of workup have you gone through? Has there been any testing done? Have you been labeled with any diagnoses? And then once we get through that initial getting to know you call, and if they decide that functional medicine really is the right path for them, then we set them up for their first initial visit. And that first initial visit is 90 minutes where we go over their entire timeline, their history from their mother's pregnancy all the way up to, whatever age they are. So we spend a lot of time diving into their environmental exposures. We want to know about any surgeries that they may have had. We want to know about any trauma in their life. We want to know what their nutrition looks like. We want to know if they exercise frequently and how often and at what intensity. We want to know how well they sleep and how they manage their stress. These are all the foundations of health. So that 90-minute visit, that first visit, we're diving really deep and getting to know that person on a very intimate level. And then after that 90-minute visit, we are going to go ahead and recommend regular blood work, that very thorough diagnostic panel through LabCorp, and then offer any advanced diagnostic testing that may be needed, like that comprehensive diagnostic stool analysis or an adrenal profile to really identify if a person's cortisol levels are dysregulated. We also have hormone testing, you name it, there's tests to look for it. But we really try to honor the person and not recommend so many tests. We try to keep it very personalized and applicable to them because I want to honor, their financial pocketbook and really just do what's necessary.
Absolutely, and not overdo it. Once again, when we're holistic, the bio-individuality comes in, and in Kerry's practice, that's what will happen. You're treated like the individual that you are, and you're assessed based on that. So we're going to take one more quick break for our commercial sponsors, and we'll be back in just a moment. Don't go away. Have you been told that you need to cut way back on sugars due to a health condition? Do you find yourself struggling to give up the sugars even though you know your health depends upon it? If you answered yes, my online Hidden Sugars class is for you. Take charge of your health and visit eatingwithv.com and take the class.
Harmony Music Lounge is an oasis for music lovers of all ages. It's a true listening room with live entertainment 6 nights a week. This eclectic vintage venue features a wide range of genres, plus special events. It's one of those places you just have to experience for yourself. Prices are affordable, the live music is exceptional. Downtown Fort Pierce, 1 block from the City Marina.
Is your insurance company telling you that you have to replace your roof? Neese Roofing is a family and veteran-owned and operated local business. Choose peace of mind and quality work with this Owens Corning Platinum Certified contractor. Join thousands of satisfied customers. Visit neeseroofing.com.
Google Bins Pest Control, Florida. Got bugs, you know what to do. Call 772-878-1972.
Welcome back to the Health Revolution with V Show. I could spend all day talking with Kerry. She is amazing. We're with Kerry Jenkins. She is a certified physician's assistant. She owns Whisper Health Functional Medicine, which you can find her at Whisper, WHISPER dash, the dash in between, not the underscore, whisper-health.com. That's whisper-health.com. So we still have a lot of stuff to talk with Kerry about. So if you've missed any part of this, please go back and listen to the whole show. You will not want to miss what this amazing woman has to say. So Kerry, what are some of the conditions that you're treating, that you treat at your clinic?
So we are treating primarily, there, like you mentioned, so many people struggle with gut dysfunction, right? They have belly pain or dyspepsia or just not really strong digestion. There's a lot of gas and bloating, constipation. So a lot of people come to us with those gastrointestinal complaints. And then they're, once they get started and we start working them up, that's where we could identify an autoimmune process that they never even knew they had, just because we're checking those lab markers. So I have a tremendous amount of females, especially in my practice, that have an autoimmune condition of the thyroid called Hashimoto's autoimmune hypothyroidism. We treat a lot of people that just have anxiety and depression and brain fog. I would say the primary chief complaint that I see in my practice is fatigue and brain fog.
Mm. And, there was a lot of that. I remember when I had the candida really bad. I had a W-anesis candida. It wasn't even albicans candida. And they were like, oh, you have to take this drug, diflucan. I'm like, nope, not doing it. But not everybody can go through that diet, right? But it was that. It was brain fog. Are you finding a lot of people with candida these days, too?
It's everywhere. It's so underdiagnosed. There's so many people, they don't feel well, they go to their doctor and they're given antibiotics. And I'm not anti-antibiotics. I'm all for antibiotics. Antibiotics save lives. But you have to understand that there's repercussions from the use of those antibiotic medications. When you're wiping out the bad bacteria that you want to kill that's causing the infection, you also have to understand that there's collateral damage, and the good gut microbes that we want to be present in really robust numbers in our GI tract, those guys, the commensal organisms, they're affected just as much as the bacteria that we're setting out to eradicate when you take antibiotics. And anytime you take an antibiotic, you have to understand that that opens the door for yeast to overgrow. So yeah, it's very frequently overlooked or just not identified.
Right. I remember when I went through, and that was a long time ago, and they're a little bit more now, but still they're not looking for it, which I love that you look for that too, because a lot of people have it and don't even know they have it. So my favorite part is talking about all of your success story. Can you share, obviously confidentially, some of your favorite success stories in your practice?
Let's see. Most recently, I had a really, really great success story with a young adult female. She came to me with pretty substantial acne, and it was really affecting her quality of life. She was feeling depressed. She was socially isolating. She wasn't going out with her friends and doing the things that she used to enjoy doing. And it was really affecting her mental health, just, having to wear makeup and cover up, and it affected her self-esteem and self-confidence. And she came and said, listen, I've been on all the antibiotics. I have taken, the anti-androgen medications. They are offering me, the heavy duty drugs, isotretinoin now, and I really don't want to take those. Is there anything that you can do that may be different to help me heal my skin? And we did just that. We did a very thorough lab workup. We did a gut microbiome test, and we identified tremendous dysbiosis in her gastrointestinal system. We prescribed a very therapeutic, specific and very therapeutic diet for her to follow. We gave her a few nutritional supplements. I prescribed her to get outside and get natural sunlight every day to make her own vitamin D. And, I will tell you, it's not like a light switch. When you decide to go down the integrative and functional medicine path, it's not like medication where it can turn a process off overnight. You have to be patient and very, very diligent. But I will tell you that over between, 8 and 12 weeks, her skin turned around and she's got clear skin. And that has in turn, completely changed her life. So that's a success story that really stands out to me as being really profound for this young adult.
Oh, that is life-changing. Because I know if I just get like a pimple occasionally, I'm just like, oh my gosh. And then I see people and that it comes from stomach. You just know it's coming from there. So yeah, that's just so frustrating. I can only imagine. That's outstanding. Do you have another one you'd like to share?
I do. I recently started working with a middle-aged gentleman, and he was struggling with psoriasis. He didn't have psoriasis his entire life. He was diagnosed in his early 40s, and he's in his early 50s now. And he was really troubled by this skin condition. Again, feeling the need to cover up and hide his skin, having social anxiety and social just awareness of what are people going to think if they see my really red, dry, flaky skin on my elbows, on my knees. So he would wear long sleeves and wear long pants, even in the summer months, which, as you know, living here in South Florida is just almost impossible. And again, we did the same approach. We did a very thorough laboratory evaluation for him. And then we did some advanced diagnostic testing and looked at his gut microbiome. And again, he had tremendous dysbiosis. He was not digesting his food well at all. So we put him on a whole protocol, really focusing on the pillars of health, the nutrition, the exercise, the sleep, the stress management. And then we worked to rebalance his gut microbiome. And in 6 months, his skin cleared.
Yeah, that's amazing. I love those kind of stories. And that's so true because it does take time. It takes us a lot of time to get our body unwell. So it takes time to get it well.
I'm so happy that you say that, because that is the part that people forget, right? They come in and they're so distraught because they've been suffering with whatever condition they have for so long, and they've had it up to their eyelids. They just want it gone. But I always invite them to take a deep breath and center into themselves and really take a moment to realize how long it took them to get to where they are. They didn't just pop up with psoriasis overnight. It took their body a long time to get to that point where the psoriasis was able to manifest. So in the same token, when we heal the body from the inside out, it does take time. So I'm so happy to hear you say that, because a lot of times people, they don't want to, they want a quick fix. And I understand that. But when you're working with a person and you're changing things on a cellular level, you have to be patient.
100%.
The body is capable of healing amazingly well if you just provide it what it needs.
I'm so glad you said that, because it is so true. I mean, between the food and the toxins, and I am just so thrilled that we were able to have you on the show. I could talk to you all day, but we have run out of time. So thank you for coming on the show. You can find Kerry at whisper-health.com. That's whisper with a dash, not the underscore, whisper-health.com. Thank you, Kerry, for coming on the show. And we will look forward to seeing you all on the next episode of Health Revolution with V.